Here's what you need to know for an EMS class test on basic life support, or BLS. First, let's talk about adult CPR. For adults, the steps for CPR include checking the scene for safety, assessing responsiveness, calling for help, checking for breathing, and starting chest compressions. Now, let's move on to child CPR. When performing CPR on a child, the steps are similar to adult CPR. For infants, you should use 2 fingers to perform chest compressions at a rate of about 100 to 120 compressions per minute. Practice these steps to build confidence in your ability to perform CPR effectively. Alright, so let's go over some key points to remember. First, adult CPR. Make sure the person is on a firm, flat surface. Check for responsiveness and breathing. If they're not responsive and not breathing normally, call for emergency help and start CPR. Begin with chest compressions, pushing hard and fast in the center of the chest at a rate of 100 to 120 compressions per minute. After 30 compressions, give 2 rescue breaths if you're trained to do so. Continue this cycle until help arrives or the person starts to breathe on their own. Remember, your actions can make a significant difference in an emergency situation. Assess responsiveness by tapping and shouting. Call for help. Check for breathing by looking, listening, and feeling for breaths. Start chest compressions in the center of the chest, between the nipples. Give rescue breaths after 30 compressions. Follow the same steps as adult CPR. Adjust the technique for a child. Use 1 or 2 hands for compressions, depending on the child's size. Give rescue breaths after 30 compressions. Check the scene for safety. Assess responsiveness by tapping the infant's foot. Call for help. Give compressions with 2 fingers in the center of the chest just below the nipple line. Give rescue breaths after 30 compressions. Remember, the key is to act quickly, stay calm, and follow these steps carefully. Practice makes perfect, so don't hesitate to practice these techniques regularly to feel more confident in your skills.